My name is Owen Miller and I'm a consultant in paediatric and fetal cardiology. So that means that I look after the heart health of children and young people from before they're born until they become adults. Well, I can't think of a better career, really. I've been a doctor now for decades and I still look forward to coming to work every time. And so working with children in paediatrics means you not only have the child to look after, but you're caring for the whole family and ensuring that the whole family fully understands their child's heart condition and working together with them in partnership for the best outcomes of the child is incredibly satisfying. So for me, paediatrics was clear and paediatric cardiology is the most interesting specialty in paediatrics. Unlike in adult medicine, in children's medicine, the child is not sick. It's not their fault they're unwell. It's not a lifestyle issue. They're usually born with something or they develop an infection or an illness, which isn't really their fault. And so you can make very small changes in a child's life to make the right diagnosis in a timely fashion or start the right treatment at the correct time, and you can change a whole life. And the positive benefits will go on for decades. So for me, it's that it's not their fault and you can do something early and you can affect the whole of their life. Seeing the children grow up and reach milestones, whether it's, starting school or a sporting achievement, or even when they're teenagers, moving on into transitioning to adult care, these are celebrations for children who are born with congenital heart disease. And so I find that the most rewarding part. Or seeing them, survive and recover from major heart surgery is incredibly humbling. I think what I try and do is I try and make sure the child, but also the parents, have a good and clear understanding of what the problem is in understandable language. So I think what they value most about me is I take my time to explain things and make sure before they leave the consultation, they have a very clear understanding of what the problem is, what the tests are, what any treatments are, and what the implications are for the child and the family. And so I think that's what they value about me. I take time to make those explanations. And I guess what I value about the patients is really their willingness to trust me, to be honest and open and have those conversations with them. And also, I think I like it when the patients have questions and really feel comfortable to ask me those questions. No, I don't have a mantra or a catchphrase, but just old-fashioned honesty, integrity, and I think the other important thing that patients really value is availability. So for me, it's availability.